Well, the presents are open and many people have spent Christmas with those they love and care about. But holiday celebrations for hospital nurses and healthcare professionals may be postponed or even canceled because they're on the front lines helping COVID patients survive so they can hopefully live to see another holiday.
We try to persevere at the end of the day and, make an impact in somebody's life.
Eric Rowland is a registered nurse at King's Daughters Medical Center in Brookhaven. While families are opening gifts and enjoying Christmas, he was working a 12-and-a-half-hour shift in the emergency ward. Every day, he and his medical colleagues are tasked with doing all they can to hopefully get patients suffering from coronavirus healthy enough to be home with loved ones. But cases in Mississippi are surging. Dr. Thomas Dobbs tweeted on Christmas that there are a record number of COVID admissions in Mississippi and hospitals are already at full capacity. But Rowland expects another surge after the holiday.
The main thing is people wanting to make sure they're staying safe for their family, keeping their family safe. There's always that chance that they're not always the safest or going through those said steps of keeping, yourself as cleanly as possible, especially in the ER. We're kind of on the front end of it, so we see plenty of that.
He tells me he's seen plenty of neighbors and members of the community battling this terrible virus.
You kind of take it personal and you make that personal attachment with each patient that does come in, and it's a hard blow,
He says hospital professionals are caring for patients like they would their own family, and the care goes well beyond medicine.
So we try to let them do the Zoom, like we're doing now, Facebook, Facebook Live.
Social media keeping patients connected to family so they don't have to fight COVID alone.
Sometimes that's all we really need is just that love and support and care.
Eric tells me there'll be a little bit of time to enjoy the holidays with his own family, but his thoughts often drift to those that he's trying to help.
We always have those patients that we deal with during the day that kind of sticks with us in our mind. We're laying in bed at night, thinking about work the next day, and we're replaying everything that we. Well,
Eric tells me after his ER shift, as part of his routine to come home safely to his own family, he changes out of his scrubs in his garage and puts them in a biohazard container. He has no contact with family until he thoroughly showers, and he is urging people to not get complacent with masks, social distancing, and hand washing. He says they are the tools that will help us persevere until the vaccine is widely available.